Welcome back, everyone, to the Relationship Blueprint Unlock Your Power of Connection. And today I have someone with me who I've gotten to know in a more deep way in the last couple months. So I'm really happy to introduce Kathy MalcolmHall. She finished her PhD in marriage and family counseling with a specialization in imago therapy. And you all know how important imago therapy is to me and my world and all of the people's lives that we have touched. So without further ado, welcome, Kathy.
Hey, Coco. Thank you so much for having me.
I'm glad you're here. You're here from Dunwoody. And for those that are listening from different parts of the world, that's a suburb of Atlanta. Is that correct?
Yeah, it is. Sort of the north end of Atlanta.
And that is where you practice?
I do. I welcome people into my home. I have a home practice with a private waiting room and private space down here, and I really love it. I love welcoming folks into my home to work on relationships, make their lives better.
I love being so intimate with my couples on many levels. And I think Imago really changes that dynamic because we typically don't see our clients as sick and we see them as regular folks that are having really natural struggles with relationships, just as we have in our own relationships. Do you see it that way?
Yeah, yes, I see that. I often say to clients, I'm in the same hospital you're in. I just checked in about 10 years earlier.
I like that a lot. Yeah, yeah. Just checked in a little earlier and been able to gain some skills on most days of the week, right?
Right. Came in for a landing a little earlier than you.
Yeah, and there they are, and they're seeking help. And that's what we're
Right.
here to do today is to help people really understand. I know your PhD, your dissertation was very important to you and very important to our Imago community to understand what you've learned and really to help couples out there who are thinking about maybe they're in individual therapy, maybe they're already in couples therapy, or maybe they haven't
Yeah.
explored therapy at all, but really helping them understand what is different about imago therapy compared to individual therapy and what can this bring that perhaps some other kinds of therapy may not be able to approach in the same way.
Yeah, exactly. Well, you're right. The part you got right was my dissertation ended up being super important to me. The research we did, and gosh, I found it so fascinating to really look at what makes couples therapy work.
Mm.
What makes it work? How's it different from individual therapy? How can we educate ourselves about what works? Dr. Colleen Bernard Lanier and Dr. Rebecca Sears also worked on this research with me, as well as Brenda Rawlings. So we moved forward after Brenda passed with her spirit in our hearts, but Caroline and Rebecca also mined this body of research. I got to look at the body of research through the lens of common factors. So when you talked to me about the podcast, I got excited about being able to bring forth this information to folks at home, like what's common in every modality that really works.
If I've got that, Kathy,
Please do.
you really want to help us really see is that many people don't realize that if they really ask their practitioner, what kind of therapy is your strength or what are you highly trained in, that most therapists might answer, I am EMDR, or I do trauma work, or I'm polyvagal informed, or whatever their answer is, but that among those hundreds of kinds of therapy, you looked at 4 common factors that made for effective therapy. Did I get that?
Which got right was I did look at the common factors. What I did was looked at the common factors of couples therapy.
And only within couples therapy. Thank you.
Right.
I can't wait to hear more.
Yeah, good. Well, I can't wait to tell you more. My intent is really to just be helpful, to educate, to help folks know what really helps, what helps in marriage, and then to be smart about who they're hiring as a clinician if they so choose to hire.
Right. So you're really one of the things our listeners today can take away is these are the things I may want to look for if I'm going to pay someone money to help me with my relationship.
Yeah. Yeah, absolutely.
And be more savvy as consumers, right? To know what to look for, maybe questions to ask, just to have a deeper understanding instead of going through Psychology Today and seeing someone specializing in 84 things and maybe couples is on there, but not really knowing who it is.
Yeah.
Overwhelming, really.
Yeah, it really is overwhelming. And one of my patron saints is Brene Brown, and she says, clarity is kindness. And so I really want to be clear today. My intent is to be clear. All this research is a little bit like, as I mentioned to you on the phone previously, it's a little bit like getting an octopus in a Kroger bag. But I really want to be able to take the complexity of it and make it helpful. So here we go.
All right. So let's start. Let's begin with the first component. Tell us about that.
Yeah, so what we found, or what we know about common factors, is that the first common factor of all good couples therapy is that the clinician really helps the couple conceptualize what's up with them. Conceptualize the difficulties they're having in relationship terms. Help them think differently from it's his fault, it's her fault, it's this diagnosis, it's that diagnosis, to what's happening between these people.
Okay, so I think that's so important to mention because what I'm thinking is that every couple that's ever come into my office has said, if they haven't said it verbally, they have said it somehow. Like, I'd be fine if you would just fix him. And what you're saying is that moving away from calling people narcissist or, he's a borderline or whatever the story is, that if they can look at what's happening between the couple, that's where the power lives.
Correct. Exactly. And thank you for bringing up those diagnostic codes. It's not that those things aren't true. Sometimes they're really true. It's just that good couples therapy helps the couple shift from vilification to partnership. How do we really look at what's happening between us if we have narcissistic and borderline personalities, if we have AD, if we have a trauma that causes polyvagal dysregulation, if all those things are true, how do we help our couples relate in a relational way and think in a relational way about what's happening between the two of them?
You're saying, and I might pause you a few times because I really think
Please.
as a therapist, we can stay in our therapist language. And I think it's so important to just highlight how important it is what you're saying, because if I go to my couples therapist and I say, my husband has ADHD and that makes it so hard for me, I have to do thus and such, that is vilification, isn't it?
Well, while the data might be correct, the posture of judgment doesn't help. So part of what good couples therapy does, according to the research, is that it helps couples move from judgment to discernment. The being able to say, gosh, we have an agreement here about our division of labor that's really wonky. Hey, partner, can we work on this? That's a different modality than diagnostic judgment vilification.
That makes total sense. I think what you're saying now will make sense to those who listen to relational contracting. You're highlighting right now is we're not going to vilify anyone. We're just going to say, hey, this isn't working. Like the division of duties, for example. This isn't working for us. Let's really look at that versus, it's all because of your blank, right?
Yes. And how do we support, should those diagnoses be true, and often they are, how do we support a person who's suffering with borderline? Because boy, it's a lot of suffering. How do we move toward love? So it's not that we don't call a spade, so to speak, right? It's that the posture moves from vilification to partnership.
I really love that, Kathy. It's so important to go from judgment to discernment. And when we do that, we have compassion, right? Then we can look at how can I support you and how can you support me? Struggle.
Right. So as we talk about this, I've noticed both in us soften because it does bring up the yummy stuff like vulnerability and compassion. And it makes the question, what's possible here? What's really possible between us? And that's what the difference between individual therapy and couples therapy is, that a good couples therapist will help you look at the diagnoses in the room and say, how is this helpful to know this? Is it helpful? How's it helpful? And how do we help this couple talk about it in ways that are connecting. And for folks who are not in therapy, gosh, please try this at home.
So when you say try this at home, let's try to model sort of a conversation that we might have as friends, maybe that
Yeah.
that are just struggling with, let's pretend I have ADHD and I'm always late. I let you down often, or I forget to call. I have time management struggles. It's part of my challenges, right?
Yeah.
We can unpack that together, can't we? We can talk about it, but I'm not going to be able to talk about it if I feel criticized, then I get defensive.
Yeah, sure.
But when I hear your compassion and about how I'm impacting you,
Yeah.
maybe that I'm not going to show up for you, or you feel this is bringing back some stuff of, being abandoned in different relationships or always having to be the parent or the responsible one. Like it's never about being late, is it?
Yeah, right. Well, now, yeah, and now we're talking at a deeper level, and this is the way we would guide couples, right? Is to say, let's look at intent and impact, and let's look at what's happening in the story we tell ourselves because someone's late. But in terms of that modeling, what for folks listening to be able to say to a friend, gosh, I know you love me. And I know you really deeply care about me. And I know you're really trying to be on time. And it's really hard work for me when you're not. What could we do? Like, what could we do? Could you text me? Could you bring me a coffee if you're coming late? I don't know, but that idea of leaning into the relationships and saying, this is a thing. Can we partner up about it? What's possible?
And I always think that really letting them know what's underneath, if I stay with up top,
Yeah.
I'm annoyed, and my time is valuable. I can get on my high horse and to make you feel really bad about yourself. Or I can say, it's my story that if you don't show up, something's happened to you, because that happened in my past, that when
Yeah.
someone didn't show up, they were hurt. And I think I go right there. Can you help me with that?
Yeah. Can you
Be
help
very
me?
different. Yeah.
Yeah, it really is. And this is the upside of individual therapy, I think, is helping people identify. Because when you go to individual therapy, it's really a lot like, okay, what are my feelings? Helping people that may not know, what am I feeling? What do I need? What do I want? What's my hopes? What's in the way of me and joy? To be able to really identify those things is what good individual therapy is. When the individual therapist starts working on the relationship with the person without the other person present, that gets a little tricky because the obvious triggers are you don't know how it's going to impact the other person. But good couples therapy and common factor one, how it helps couples deal with those feelings that people have discovered in stories in relational terms, helping them own the impact, not coming in like a wrecking ball.
So ownership becomes really important, and also moving away from judgment to discernment and what is the possibility for us. I really like that because it brings hope to the relationship, and you can have connection without self-awareness and without saying to yourself, I can make him the villain if I want to, but is that effective? That's my favorite question lately. Is
Yeah.
my behavior getting me what I want? Is it effective? If it's not, then maybe, we unpack it. We kind of try to figure out what will be effective.
Yeah, exactly.
What is the second component that you study?
Yeah. So the second common factor of all good couples therapy is disrupting the dysfunctional patterns. So typically what we see with couples is people cycle. They get in cycles, they get in patterns, habits, and being able to say, couple, let's get on the balcony. Let's get on the balcony and look at this. And, Imago has a beautiful dialogue structure that helps couples really do this, disrupt the pattern of criticism and defensiveness, or octopus and turtle, as we say in the Imago community, of the one that's always reaching and the other one that's shut down. And the ability to really disrupt patterns and implement love between equals, being able to talk about what's happening inside of them and connect more effectively. So, there's a lot of common things about couples therapy. One of the uniquenesses of the therapy you and I practice is the couples dialogue, which it's a sacred cow, which we adore. And for good reason, right? It really helps people. So many miracles. I mean, I think marriage is a miracle anyway, but so many miracles are born in those moments when a good couples therapist is holding a couple in dialogue structure and really just supporting them as they come back into regulation and hold each other, move toward love.
My passion for this work is when a couple comes in and they're starting the dialogue about their core scene, that the fight that they have over and over again in a
Right.
different outfit, right? And then,
Right.
as you've said so brilliantly, within the structure of the dialogue, they are able to see or hear or express something that is absolutely new to them about this old scene. And the dialogue does create that structure to look at the pattern in a different way. And as they finish the dialogue, saying something to the effect of, God, we fought about that 100 times. I didn't think this would help me, but it did. Now I hear it differently. Now I see it differently. And as you said in the beginning, it's this shift in perception that can happen.
Yeah. Yeah. And I don't know how many of your listeners are dialogue savvy, but what we mean by dialogue structure is a very calm, mostly way of just sitting face to face. One partner speaks and the other one listens deeply. And it's the only responsibility of partner B is just to repeat back, hey, is this what you're saying to me? It quiets the autonomic nervous system so that you're not thinking, okay, that's wrong. That's wrong. That's wrong. I disagree. Essentially warring for one narrative, right? Creating this big fat, two ticks and no dog. Like, it's just like, we are just so symbiotic. It's just exhausting. Dialogue structure helps couples really pull that apart and create love between equals. Let me hear you.
Can I ask you a favor?
Yeah.
We keep talking about the dialogue on the program, and I think we've done it once, but I wonder if you'd allow me, this is a mini contract,
Yeah.
and she could say no. Kathy is welcome to say no, but would I be able to give you an appreciation in the dialogical form for our listeners?
Yes. Yes, absolutely. I love this.
You're willing to receive?
Yeah, of course. I'd love to model.
Yeah, so the first thing we would do really is get ourselves centered. So Kathy and I did that earlier before the podcast, but we may take a moment now just to breathe and to remember the last time we were together, remembering, and this is what you do at home, you remember what you really love about your friend, your partner, anyone that you want to dialogue with. And then once you feel your heart soften, I would ask for an appointment. So, Kathy, are you available for an appreciation dialogue?
I am.
So, what I really appreciate about you is I love your metaphorical, poetic language.
So what I'm hearing you say is what you really love about me is my metaphorical, poetic language. Did I get that right?
You got me. And when you talked about, it's like putting an octopus in a paper bag. It's so visual for me that I can see and feel your.
Yeah. So when I quoted that particular one, octopus in a Kroger bag or octopus in a grocery bag, it really helps you see and feel my thoughts. Did I
Yeah.
get
And
that right?
yeah, and what a great teacher you are.
And what a great teacher you think I am.
Yeah, because being able to help people see things through metaphors and helping the brain make connections is so powerful and so important to be able to digest whatever you're teaching.
Yeah, so you think that helping the brain, the pictures, the word pictures, and helping the brain make connections in a different way than just hearing words really helps people get a visual and take it away better. Is
Yeah,
that right?
you got me. And so I love that in writing, but I also think it's just a powerful teaching method.
Yeah, so you love it in writing when you read it, but you think it's a powerful teaching method.
Yeah,
Did I get that right?
you got me. And so would you be able to summarize?
You said, so in summary, what I'm hearing you say is that you really appreciate the way I language things. You like the metaphors, you like the word pictures, and you think it's a great teaching style because it helps people make connections in at least two ways, the verbal, but also the visual, and that you
Yes.
appreciate that.
Yes. Yes, and the part you missed was that I think you're a wonderful teacher.
And the part I missed is you think I'm a wonderful teacher. Well, thank you. And all that makes sense to me because I do love a word picture. It was modeled to me very well by my mother, who was sort of a cliche queen. And I grew up in the hills of Kentucky. And so I have a lot of nature. I think in terms of nature a lot.
Is there more? I think that's it. So is there an empathic statement you want to make, or
So that makes sense to me. And my guess is you feel
I feel joyful when you use metaphors. It's
oh,
not really relaxed. It's more, it's like a chuckle and joyful, like
ah,
seeing that octopus in the Kroger bag, it makes me laugh. And I love to feel joy and make connections. Yeah. So you got me. You got me.
yeah, it makes you feel joyful.
So for our listeners, that is, you make the appointment, you mirror what you've heard. I don't know if you noticed, Kathy, but she said at some point, is there more? And until I'm finished, until I say, no, that's about it, then she gave me a validation, which explained why that all made sense to me. And then an empathy statement, which just guessing. So I imagine that left you feeling, and she said relaxed, and that's okay that she guessed. But I said, no, it wasn't really quite relaxed. It was joyful. So guessing the feeling is just reaching over into my world. She can't read my mind, but she was able to guess, which made another connection. So this is a very small example of a dialogue, but appreciations are something you can do at home anytime you want. There has never been a time that I haven't said to my husband, are you willing to have a dialogue about an appreciation for you? And he said, oh, absolutely not. But how many times have I said, I really want to sit down and talk? And he looks like, I'd rather mow the lawn. So it's a really good way for people to start to pivot at home to try on some of these things. And the acronym mirror over and over again, validate, empathize.
Right. And you did a beautiful job of cueing me to that empathy statement, which was great modeling, because folks fall in and out of dialogue at home, of course, my
Right,
goodness.
right.
Because it's a lot. It's really a lot. Yeah. So well, thank you for giving me that opportunity to model that. I think it's great. And it's so great that you use positivity, because in particular with the octopus in the Kroger bag, all that research that we found, the thing that people love about imago therapy is focus on communication and positivity. That is a very big way that we interrupt the negative cycling. Our brains have a negativity bias. We just do. It's funded anthropologically and calcified in childhood. And so as imago therapists, we really interrupt that process and want to help the couple with positivity, because we cannot learn and bond with negativity afoot. It's just really difficult.
And Kathy, can you expand for our listeners the definition of a negativity bias?
Yeah, so it's a little part of our brain, but it really is big. It's got a big impact. It's the fight flight brain. And the fight flight brain gives us the potential of worst case scenarioing and seeing things through what's going to be wrong, what's the next thing's going to be wrong, and what are they going to do then? And so we can problem solve. And my husband likes to say all those Zen Buddhists were eaten, because those of us who could predict, there's a rustle in the leaves, it must be a predator. No, it was really, someone bringing you, some lovely flowers. That ability to predict, we will often predict bad. So with that negativity bias, you're also sort of being critical about them. It really has people in a very vicious cycle of two ticks and no dog. That's the way I think about it.
So, Kathy, the negativity bias, what you're really helping us understand more deeply is that we're wired that way. We're not trying to be mean or negative or bad, but that negativity bias is important for our functioning, because it helps us prepare for if there's a car coming at me and he's running the red light. I'm predicting what could happen. I may stop or swerve to the right or do something that's going to help me survive, right? All that kind of thinking really doesn't help in our relationships.
Yeah, it doesn't. We're prone to negativity. So being able to sit and really notice, okay, gosh, I don't need my fight flight system in this situation. I'm just talking to my beloved.
Yeah. And they're really not the enemy, although I'm mad at them or they're mad at me. Like reminding ourselves, like, this is the person we chose to live with for the rest of our life. Like, can I see his innocence? What is that Brene Brown says about a generous assumption about people?
Oh, yeah. Yeah. Benefit of the doubt, generous
And
assumptions, right?
yeah, can I assume that maybe when Kevin's being, I don't know, short with me, that he has other things on his mind and maybe not take it so personally, that ability is about giving someone that we care about generous assumption instead of going right to that negativity bias.
Yeah. When I learned to think about Ramsey, I bet he's up to good. I bet he's up to good. That was so helpful and really hard for me to do. Super hard for me to do because, yeah, because of negativity bias and, some early training. And I was a young bride. But when I learned to say, I bet he's up to good, I didn't like it and I didn't want it, but I bet he was up to good. That really was transformative. And so, in more under the please try this at home, generous assumptions and benefit of the doubt, and being brave enough to say, what if your partner's up to good?
Can I stay curious enough, long enough to find the good, to understand and reach out instead of shutting down or yelling back or whatever the pattern that I may
Right.
normally take?
Right. Yeah, definitely.
So the third,
The third is, and there's four of them, and this is one of my favorites actually, expand the direct treatment system. And because it's surprising to people. Yeah, it's kind of surprising that the third thing that a good couples therapist can do is really say to a couple, who else is on your side? What other church, synagogue, system, family, neighborhood is for your couplehood, is not trying to get a straw in your Coke all the time, but really supports you to have good rituals of connection, to take your daily, weekly, monthly, quarterly, yearly times that you get away. So who in your world supports you? And also for us as couples therapists, pointing couples to workshops, giving couples books to read and podcasts. It's I'm so excited about your platform. I have, my couples never leave my office that they don't have one of your podcasts in our little group chat, because I think extending the treatment system is so important. Caroline and Jason are doing a couples cafe, and Bob and Wendy Patterson here in Atlanta do workshops, and Bob Patterson and Suleiman Nuruddin do the men's clearing. That's so important because look, we don't raise to the level of our goals. We fall to the level of our systems. And if the systems around us that support the couplehood are only about taking from them, getting them to do more, it's tragic. And the ability for us to help our couples say, who's for you? Who's giving you margin? Because, if that couplehood falls apart, it really impacts society. It's a social difficulty when couplehood split. Now, sometimes people need to part ways and bless and release each other. I really, truly believe that. And if they can stay together, it could be a real help to them psychologically and spiritually. And so, I'm pro marriage. I'm pro staying together with, understanding people can't always. But being able to extend the treatment system and help couples see what's around them. And gosh, the Imago community has just been so wonderful about creating opportunities for couples to be exposed to that relational paradigm. We're good at creating opportunities for people to get more help, to make it more normal within their reach, so to speak.
and I'm just kind of circling back for our listeners, that the individual paradigm was the way that we saw therapy for a really long time. Like if, say, in the 80s, you go get help, I'll go get help, and then maybe we can work on our relationship, which the relational paradigm has the opposite message, which is you can be each other's healers. Who else? So you go to a therapist once a week, and gosh, you hope that makes a difference. And I am certainly not discouraging individual therapy, but when I see a couple and watch the growth that happens in that dynamic, it is just so powerful. Individual growth, I think, happens within that dynamic. Some weeks it's for one, some weeks it's for the other, some weeks it's with both.
Yeah, exactly. And you brought up such a good point that, couples therapy comparatively is pretty new. It started emerging in the 80s. Before they had what I call proximate counseling. People are proximate in the room, but they're not looking at what's happening in the between. It's really they're talking to the therapist, he's talking to the therapist, she's talking to the therapist, she's talking.
I think that, when you were talking about resources, I can't highlight enough that a couples workshop, there's not a statistic that's accurate, but people have reported 6 months of therapy in one weekend. So I hear people
Sure.
saying, I don't have time. I don't want to spend.
Yeah.
And I'm thinking about all the money people spend on divorce.
I think it's super vulnerable for people. And I think that's why I love that we're talking about this, is it educates people, is that when you go to an imago therapy workshop, you're not hanging your dirty laundry on the line. You're essentially, it's an educational workshop, and you are
Yeah, it is.
educating yourself about the
Psychoeducation,
practices.
right?
Yeah,
Yeah.
totally. Yeah, it's not therapy.
One of my favorite stories was during a workshop. I had a couple who didn't say a word. I mean, they talked to people in between when we were on breaks. They were friendly to us on breaks. But if you asked me, did they get anything from the workshop? Kathy, I would have told you, I don't think so. I'm a little worried. They kind of had stoic faces. They did the practices on their own, which was wonderful, but they didn't raise their hand. They didn't contribute much. So after that weekend, I guess it was a Tuesday, and the woman called me and said, that was transformational. And I shared with her, I said, I was so afraid it wasn't for you. I made up a story that this wasn't for you, or that you didn't find it meaningful. And she said it was just the opposite. So
yeah, you can have a very private experience at an imago workshop. You can simply look at in our lives who supports our couplehood.
yeah.
Who supports us, what happens between us, who says, prioritize yourselves, take a date night. Here, let me take your children. Those people you want to, those people you want to really invest in and take advantage of.
And sitting around with your girlfriends and talking about how awful your husband is, or the husband's going to the bar and complaining, is not exactly the kind of resource that you're talking about.
Correct.
In the negativity bias, we do this naturally. And so, again, going back to Kathy's point about interrupting patterns, maybe for just a little while we're working on our relationship, we have to look at all these ways that we are not giving to the relationship, but we're actually taking withdrawals, like a bank account. When we don't give much to it, we're broke, no saving, right?
Right. And when I'm meeting with my girlfriends, we're just seeking validation. We're up to wanting validation because we're in pain. And that makes a ton of sense. But a big piece of what imago therapy does so well, I believe, is it helps people really say to their partners, helps me say to Ramsey, well, it makes sense to me because I did blow up. I did lose my temper. And my guess is it made you feel really frustrated and sad. So that ability to help couples with the thing that we all really need is validation. It holds couples in a dialogue structure that helps them get it. So there's less needing to go looking elsewhere.
What you bring up too is that you can use a piece of the dialogue at any time. Say, I've interrupted Kevin in front of people at a dinner, and I could watch him shut down or something. And later being able to say, it makes total sense that you shut down because I interrupted you, and I am so sorry. Even better if I can say it in front of everyone. I think what you're bringing up is so important, to validate that what you did had the impact, even if it wasn't your intention.
For sure. Yeah. Listen, we're never intentionally, I think we're rarely intentionally hurtful. I mean, there are some cases in which there's so much going on that, domestic violence situations and other kinds of situations, those don't qualify for what I'm getting ready to say. But I believe that most of us are just really never up to bad. We are really up to good, and finding an effective way to be in the relationship is part of what imago therapy helps couples do.
Absolutely. Will you share with us that fourth?
Yeah. So the last one is expanding and enhancing the therapeutic alliance. And what this one means, this is how they articulate it in the literature. And what this one means is really being able to connect with, if you're choosing therapy, connect with your therapist. In the early research, it tickles me to death because they talk about this being like, your therapist needs to have an effective personality. That phrase is so funny because I've known some great therapists that I wouldn't necessarily qualify them as having effective personalities, but
What is it? Personality.
I don't know. We love the word effective, but there wasn't a lot written about that. But that term just tickles me to death. But I think what is really true about when couples therapy works, it's because you've negotiated the contract well. Episode number 2 in your series. You have an agreement with your therapist that is clear and mutually agreed upon. I ask my couples when I work with them, can we have an agreement that I can be positive with you all? It's going to be scary because you're going to be afraid I'm going to forget all the pain and difficulty. But could we have an agreement that we bring a positive lens? And let me tell you why. I, quote the research and talk about how helpful it is for me as their clinician to be able to highlight what's going well. Getting agreements clear about what is expected on both ends, clearly and kindly, makes the therapeutic alliance. It enhances the therapeutic alliance. And doing that every session, I think, is really important.
I'm thinking too of another contract that I try to bring up with my clients is that, especially when they're highly charged, maybe they've just had a recent thing that's been really hard. And I
Right.
just ask, do I have your permission to interrupt when I see you're going down the rabbit hole? Because I know you
Yeah.
do that at home for free. And
Right.
it's very painful to watch you do more harm to each other. So
Yeah.
may I have your permission to interrupt you when I see that start to happen? And it's really very in alignment with what you said about, can you let me be positive with you? I want what's best for you. And when I see you having ineffective behaviors with each other that are negative, right? It's feeding into that negative bias. Can we do something different? Because we're interrupting the pattern.
Exactly. And having an agreement about that. I mean, people could say no. And I absolutely have had people say no, which I honor. And, then we have to sort of figure out how we're going to be together around that. But I absolutely think it's important. The other piece of that I want to mention is that another thing about enhancing the therapeutic alliance is making sure that you're tracking safety and challenge, that getting that nexus of making sure clients feel emotionally safe enough in the room and with each other that you can bring a challenge to them. Because validation and empathy and understanding, all terrific. But if couples don't leave with, here's a new thing to try, and it's going to hurt, it's going to be a little scary, because moving toward love is always a little scary. It's vulnerable. It's like a puppy laying on the floor with his belly up. And so, do I have permission? And do you feel safe enough for a challenge? Those things enhance the therapeutic alliance.
Yeah, and I think that contract is so important because do you feel safe enough for the challenge? Either they're going to say yes or they're going to say no, and then you can troubleshoot the no. But I think it's a really great question. Do you feel safe enough for the challenge? Because how do you grow? I mean, I have not grown personally by staying the same, doing the same thing, not taking risks. Although I'm pretty risk adverse, or I used to be prior to being in the hospital about 15 years ago, the same hospital you entered. I think that I've learned so much more about risk taking and how powerful it can be because we really do have all this tremendous power inside of us. It's just been scary. It's scary sometimes.
Yeah, for sure.
That's key to all of this. Was
Yeah, but safe enough, right? Safe enough for a challenge.
Yeah, safe enough. Is there anything else that you want to share with our listeners today that maybe we've skipped over or left out?
I don't think so. I'll think of 100 things after I get done, but
Right.
now I think it's enough.
Do you think you would go through the 4 just very briefly to summarize what your findings were?
For clarification, I don't think I was super clear about this, Coco. I personally didn't find the 4 common factors. Those were already found. What I did was I looked at all the interviews that we did with Imago clients. I looked at those 4 factors and I said, what did our clients say that line up with those particular common factors? When couples talked about the nexus of safety and challenge with the therapist, feeling like, gosh, I felt safe enough that a therapist could say, hey, you're shooting yourself in the foot here. That all that data, I had the privilege of hearing so many couples talk about their experience and then aligning it with the 4 factors. So the 4 factors are not my original work. None of it's my original work. I just got the octopus in the Kroger bag. But the 4 factors are conceptualizing the relationship in relational conceptualizing conceptualizing the difficulties in a relationship in relational terms, stopping vilification, ending blame and criticism, disrupting the dysfunctional patterns through the dialogue structure. And we do it in Imago through the dialogue structure and positivity. And appreciations, expanding the direct treatment system. And the way we do it, in Imago is all kinds of workshops. And then expanding the therapeutic alliance, which is making sure you have the right fit for you.
So I'm really excited, even more excited about your research now that I understand more clearly what your research was about and what you concluded, because I feel that as a therapist, I, of course, have tried different models, and I have never experienced anything as transformational as the Imago meta theory and its impact on couples. And so just to hear your research and the other researchers that have had PhDs in marriage and family with a specialization in Imago therapy has really just validated something that was a feeling and an experience I had had. But now when you have all the data, it really just does validate how important our work is and how important it is that we make sure that we're looking at all four of those components as we're working with our couples continually so that
Correct.
can be effective and really make a difference in lives. It's really a gift to help people know how to look for an effective couples therapist and give our listeners just an opportunity to be more knowledgeable, be a better consumer about who they hire to help them navigate this really challenging journey and who to entrust with their lives and their relationship. And as you said, the children that are effective. I forget which person said this recently. Maybe it was Sophie, that we're creating the playground in which our children are building their Imago match, meaning they're watching us in all our interactions and they're learning, if my dad never comes home in the evening and my mom does everything at home, how does that impact that child growing up, who they're going to choose in their relationships? Because sometimes in the grown-up pain, we forget about our impact on our children and the relationships that they will form, not all because of us, but partly because of us. So it's too important to just go to anyone, choose wisely. And I think this episode will really help people do that. So thank you, Kathy.
Yeah, absolutely. I hope so. Well, thank you for having me. It's really been fun and generative. I appreciate it. I appreciate you.
Thanks, Kathy. So everyone, thank you for being with us today on the Relationship Blueprint. It's 25 episodes now. We've hit a benchmark. We're in 230 cities now and 29 countries. And it's all because of our listeners sharing, people like you, Kathy, therapists who are listening. I'm having my students listen to the podcast because there's many lectures in every podcast that they can take with them and share with their clients so that their clients can benefit from the knowledge of all of our wonderful therapists that have joined us in the Relationship Blueprint. So signing off for now, everyone. Thank you for being with us, and like us on Instagram, like us on Facebook. Please make comments, whether you listen on Apple or Spotify or YouTube. We're really grateful for you listening, and we enjoy all of your feedback. All feedback is providing me with a method to evaluate how can I make this podcast better. So don't be shy. Let us know what you need. And until next time, take care.